How have targeted therapies for lung cancer evolved? Imagine a world where cancer treatment is no longer a one-size-fits-all approach. Over the past 20 years, targeted therapies for lung cancer have made that vision a reality. These treatments have shifted from broad, often harsh chemotherapy to precise medicines that attack specific genetic changes fueling the cancer. This evolution began with scientists discovering that certain genetic mutations in lung cancer cells could be targeted directly. Instead of just trying to kill cancer cells with chemicals that also harm healthy tissue, doctors now focus on the genetic drivers of the disease. In the early days, lung cancer treatment mainly involved surgery and chemotherapy. Chemotherapy used drugs like platinum compounds combined with others, but these often caused significant side effects and only modestly extended survival. For many patients with advanced disease, options were limited. Then, around the early 2000s, breakthroughs in molecular biology revealed that some lung cancers had specific genetic mutations. This discovery opened the door to targeted therapies that could block these mutations and stop the cancer from growing. One of the most important milestones was the discovery of mutations in the epidermal growth factor receptor, or EGFR, gene. Around 2004, scientists found that some lung cancers had abnormal EGFR activity. This led to the development of drugs called EGFR tyrosine kinase inhibitors. These drugs, such as gefitinib and erlotinib, specifically block the signals that cause cancer cells to grow. Patients with EGFR mutations often saw their tumors shrink and lived longer with fewer side effects compared to traditional chemotherapy. As research continued, new generations of these drugs were developed. The second-generation drugs improved on the first, and third-generation drugs like osimertinib offered even better targeting and fewer side effects. Osimertinib is now used not only for advanced lung cancer but also in early stages after surgery, aiming for a potential cure. Alongside EGFR, scientists discovered other genetic changes that drive lung cancer. In 2007, they identified rearrangements in the anaplastic lymphoma kinase gene, or ALK. This led to the approval of drugs like crizotinib, which effectively target ALK-positive lung cancers. Later drugs such as ceritinib, alectinib, brigitinib, and lorlatinib proved even more effective, offering high response rates and longer survival. The list of targeted therapies has grown to include drugs for mutations in other genes like ROS1, RET, BRAF, MET, NTRK, HER2, and more recently KRAS. KRAS mutations, which are common in lung adenocarcinomas, were once considered impossible to target. Now, drugs like sotorasib have shown promise in treating these cancers, marking a major breakthrough in the field. Advances in genetic testing technology have played a key role in this progress. They allow doctors to identify the specific mutations present in each patient's tumor, enabling personalized treatment plans. Targeted therapies are now often combined with immunotherapies or chemotherapy, depending on the genetic makeup of the cancer. This tailored approach improves outcomes and reduces unnecessary side effects. Despite these advances, challenges remain. Cancer cells can develop resistance to targeted drugs over time, making treatment less effective. Researchers are actively studying these resistance mechanisms and working on new drugs and combination strategies to overcome them. They are also exploring ways to better understand rare mutations and develop therapies for those cases. In summary, targeted therapies for lung cancer have evolved from generic chemotherapy to highly specific, mutation-driven treatments. This progress has improved survival rates, reduced side effects, and emphasized the importance of genetic testing in lung cancer care. While ongoing research continues to refine these therapies, they representing a major step forward in personalized medicine. Patients should always consult healthcare professionals to determine the best treatment options based on their individual genetic profile and overall health.